Today, the topic we're going to discuss is the WHO Action Plan for Patient Safety, along with the details of its core components. The lecture will comprise of the introductory session, along with that, what is actually the patient safety plan, why it is important, what is the burden of health errors, key components of the WHO Action Plan for Patient Safety, along with its implementation and impact on patient safety, and in the end we'll have a concluding remarks. The 7 core components that we're going to discuss are: number 1, establishing the culture of patient safety; number 2, building capacity for patient safety; number 3, implementing patient safety incident reporting and learning systems; number 4, integrating patient safety into clinical practices; number 5, strengthening medication safety; number 6, ensuring surgical safety; and the last one will be improving infection control. Every year, millions of people around the world suffer from health-related errors, and these can range from medication mix-up to surgical mistakes that can have devastating effect on the patients as well as their families. That's why WHO has developed an action plan for patient safety. The plan aims to reduce the harm caused by health errors and improve the quality of care provided to the patient worldwide. By prioritizing patient safety, we can ensure that our healthcare system is effective, efficient, and most importantly, it's safe. The WHO Patient Safety Plan was initiated in 2004 by the collaboration of the member states, healthcare professionals, and other stakeholders. The aim was to reduce the harm caused by healthcare associated errors, infections, and other adverse events. The WHO healthcare associated infections affects, according to WHO, healthcare associated infection affects millions of patients every year, leading to prolonged hospital stays, long-term disabilities, and even deaths. Medication error is also a common cause of harm to patients, especially in the low and middle income countries. The WHO Safety Action Plan aims to address these issues through multi-pronged approach that includes improving infection control practices, promoting safe use of medications, and strengthening health system to ensure safe care delivery. The adoption of WHO Patient Action Safety Plan was in May 2019. The World Health Assembly adopted the Global Action Plan on Patient Safety, which includes WHO Safety Action Plan. Significant milestones so far. WHO Patient Safety Action has set targets for various years, such as reducing the health-associated infections by 30% by year 2020, though we are still far away from that. Another significant milestone that is the establishment of the Global Patient Safety Network in 2018, which aims to improve patient safety through information sharing and collaboration. What is this plan? The WHO Action Plan for Patient Safety is a comprehensive framework that aims to improve patient safety worldwide by providing guidance and tools to healthcare system to reduce the risk of harm to the patients. The purpose of this plan is to actually promote the culture of patient safety in the healthcare setting, where the patient safety is prioritized and integrated into aspects of care. The scope of action includes identifying and addressing systemic factors that contribute to health errors, promoting transparency and accountability, and empowering the patient and their families to be active participants in their care. आसान अल्फाज में मैं इसको इसी तरह कहूँगा कि हमने एक सेफ इन्वायरमेंट पेशेंट को प्रोवाइड करना है, जिसमें हमने एक ऐसा सिस्टम बनाना है कि जहाँ हम अपनी गलतियों से सीखें, पेशेंट और पेशेंट की फैमिली को अपने साथ लूप में लें और ट्रांसपेरेंट और अकाउंटेबल हेल्थ केयर सिस्टम हो जहां हर कोई रिपोर्टिंग करने से झिझकिचाए ना, ताकि हम अपनी गलतियों से सीख कर बेहतर हेल्थ केयर डिलीवरी या बेहतर हेल्थ केयर सर्विसेज प्रोवाइड कर सकें। क्यों इम्पॉर्टेंट है? व्हाई इट्स इम्पॉर्टेंट? हेल्थ एरर्स कैन हैव डेविस्टेटिंग कॉन्सिक्वेंसेस, इमोशनल डिस्ट्रेस, फिजिकल हार्म, डेथ ऑफ द पेशेंट्स। हेल्थ केयर प्रोवाइडर्स के लिए क्या होता है? एरर्स can bring to feeling of guilt, shame, burnt out, legal and professional consequences. There are effects on the healthcare system, economical system and reputational cost of errors, which can erode the public trust and confidence. Prioritizing patient safety is crucial. It's not only for ethical purposes, but for moral reasons and also ensuring high quality of patient care, which is effective and efficient. By investing in patient safety, health organization can reduce the incidence of health-related errors, improve patient outcomes, and enhance the overall quality of care. जब गलतियां कम होंगी या हम अपनी गलतियों से सीखेंगे, उम्मीद यही की जा सकती है कि वो सिस्टम पेशेंट के लिए ज़्यादा सेफ होगा। बर्डन ऑफ हेल्थ केयर कितना है? मतलब इनफैक्ट इट इज़ अ प्रॉब्लम इन द डेवलप्ड कंट्रीज एज वेल. वी डोंट हैव मच डाटा अबाउट द लो एंड मिडिल रेंज इनकम कंट्रीज, बट इवन दैट, in fact, according to WHO, health errors is one of the leading cause of death and morbidity globally. These can occur at any stage, from the time of diagnosis or to the treatment, and can have devastating consequences for both patients and their families. As we have already discussed, it can have economic as well as social burdens on the healthcare system as well. Key components of WHO Action Plan for Patient Safety. Firstly, leadership is crucial. Unless अगर आपकी political will ना हो to consider patient safety as an important component of healthcare system, then आप उससे आगे नहीं जा सकते. Because it will be the leadership that will establish a clear lines of accountability. It will promote transparency and empower the staff to speak up about the safety concerns. Second, जो important चीज़ है, that will be the patient engagement in the patient engagement is critical for ensuring healthcare services, as they are the ones who are directly affected by the healthcare services. So उनकी responsiveness, उनकी family की involvement is the key to go forward. Thirdly, safety का culture. The safe culture refers to the values, attitudes and behavior that will shape the healthcare provider, how they think and act around the patient safety. This can be fostered through education and training, programs that promote the understanding of patient safety. अगर आपको जब तक यही नहीं पता लग रहा कि आप कुछ गलत कर रहे हैं, तो आप उस गलती को कभी पकड़ भी नहीं पाएंगे. तो उसके लिए सबसे पहले सेल्फ ऑडिट करना या वो सिस्टम बनाना जिसमें ऑडिट्स हो सके, कि जहां पेशेंट सेफ्टी को बुनियाद बनाई जाए, और उसके हिसाब से ताकि एक ऐसा सिस्टम डिफ़ाइन करें या डिज़ाइन करें कि जहां गलतियां रिपोर्ट हों, और उन रिपोर्टिंग के को मद्देनज़र रखते हुए आप अपने सिस्टम में चेंजेस ला सके, ताकि पेशेंट और किसी पेशेंट को उन गलतियों से नुकसान न पहुंचे. एंड फाइनली, एजुकेशन एंड ट्रेनिंग वो असेंशियल है फॉर इक्विपिंग द हेल्थ केयर प्रोवाइडर्स with the knowledge and skill they need to provide safe and effective care. This includes training on the best practices for medical management, also includes the practices of infection prevention control, and improve their communication skills. For understanding of WHO Patient Action Safety Plan, the understanding of the core components is very important. And the first component is establishing the culture of patient safety. This involves actually creating an environment where patient safety is the top priority and all the healthcare workers and the system is working to improve it. इसमें दो चीज़ें बहुत important है. One is leadership and the second is communication. Leadership will involve setting up clear expectation regarding patient safety, providing resourcing and support, and holding staff accountable for their actions. Unless आपकी लीडरशिप पेशेंट सेफ्टी को टॉप प्रायोरिटी पर रखे, उससे आगे प्रोसीड करना पॉसिबल नहीं होगा. And communication involves a fostering of an open and honest communication between healthcare professionals, patient and family that promotes transparency and trust. Open communication अगर नहीं होगी तो उसमें बातें छुपेंगी और अगर बातें छुपेंगी तो वहाँ safe culture कभी भी नहीं होगा. We'll be going through what is patient safety, the safety culture, what are the benefits of patient safety culture, leadership commitment क्या चाहिए होगी, staff engagement, how we'll communicate and improve teamwork, risk assessment and management, and how we'll work continuously for improvement in the patient safety culture. Patient safety culture रेफर करता है उन एटीट्यूड्स को, उन बिलीव्स को, उन परसेप्शंस को एंड वैल्यूज़ को इन द हेल्थ केयर ऑर्गेनाइजेशन एंड देयर्स और उनके स्टाफ में इन रिलेशन टू पेशेंट सेफ्टी. आप किस तरह काम करते हैं, क्या दिमाग में रख के काम करते हैं, आपकी परसेप्शंस क्या हैं और आप कितना वैल्यू करते हैं पेशेंट सेफ्टी को, यही डिटरमाइन करेगी कि आप वो कल्चर सस्टेन कर पाएंगे कि नहीं. It is important for healthcare organization to establish a culture of safety because it is a proactive approach. जहाँ where you identify and manage the risk associated to patient safety. आप इस चीज़ का इंतज़ार नहीं करते कि कोई चीज़ ख़राब हो जाए, पर आप एनालाइज करते हैं डाटास को कि जहाँ जहाँ मिस्टेक्स हो रही हैं उनको वक्त से पहले करेक्ट कर दिया जाए ताकि एरर्स कम से कम हो. So this will all automatically promote the culture of incorporate the culture of patient safety into the system. Benefit क्या है of establishing patient safety culture? Establishing patient safety culture in healthcare organization can have numerous benefits. Number one, जो improved patient care and outcomes. When the patient safety becomes a top priority, healthcare providers are more likely to take steps to prevent medical errors and ensure that the patient receives the best possible care. This can lead to overall better health outcomes for the patient and higher level of trust between the patient and the health system. Additional benefits क्या हैं? If we incorporate patient safety culture, it can reduce medical errors by establishing the system and processes that prioritize patient safety. Healthcare organization can identify and address the potential risk before they cause harm. क्योंकि आप एक कांस्टेंट प्रोसेस में लगे होते हो जहां आप अपना ऑडिट या डाटा देख रहे होते हो, तो ट्रेंड्स आपको मालूम हो जाते हैं कि यहाँ से आपकी मिस्टेक्स हो रही हैं. द सिस्टम पिक करता है उसको और उन पे काम करता है ताकि वो गलतियाँ कम से कम हो और पेशेंट को सेफ ट्रीटमेंट प्रोवाइड की जाए. ऑन द अदर हैंड, पेशेंट सेफ्टी कल्चर हैज़ इंक्रीज सेटिस्फैक्शन लेवल. As the outcomes improve, both the patient as well as the healthcare provider satisfaction level increases. Leadership commitment is essential. Without leadership commitment, you cannot pursue WHO National Patient Safety Plan. That's not possible. Leader must set the tone of organization by prioritizing the patient safety and making clear that it is the top priority of the health organization. This can be demonstrated through actions such as allocating resources to the patient safety initiative. अगर जब तक रिसोर्स allocation particularly इसके लिए ना की जाए और उसके ऑडिट ना किए जाए तो आगे जाना पॉसिबल नहीं होगा. Training and education, particularly in regards to patient safety, and regular communication with the staff about patient safety goals and progress. इसकी एग्जाम्पल ये है कि implementation of the reporting system for adverse events. तो जब लीडरशिप स्टाफ को एरर्स रिपोर्ट करने के लिए इनकरेज करेगी और डेमोन्स्ट्रेट करेगी ये कि एरर रिपोर्टिंग will not cause harm to the staff, but actually it will be used to improve the system and identify the mistake, and we are learning from that mistake, then staff की reporting better होगी. And that will come with the help of leadership. Another example इसकी होगी कि आप patient safety committees बना लें, which can provide guidance and oversight the patient safety initiatives. So leadership commitment in regards to patient safety culture is must. The other important component is staff engagement. Staff engagement is a crucial component of establishment of the patient safety culture. When staff members are engaged in the patient safety initiative, they become more invested in the success of the initiative and are more likely to participate in the activity. How to engage them? Education and training program. By promoting the staff to gain more knowledge and skill, they need to identify the reporting system or the potential harms. Healthcare organizations can create a culture of vigilance and accountability. So staff involvement is must when it comes down to promoting the culture of patient safety. Another way is involving them in development of policies and procedures. When they know that their say matters, they will be more involved in the promotion of the culture of patient safety. Communication and teamwork. Well, they are important in all aspects of healthcare system. And so will come for patient safety as well. Teamwork involves collaboration between different healthcare professionals, including doctors, nurses, pharmacists, and staff members. When the communication is open and effective, it helps to ensure that everyone is on the same page and working together towards a common goal of patient safety. हम सब as a team काम कर रहे होते हैं, whether doctors हो, nurse हो, pharmacist हो. अगर किसी को भी कहीं भी गलती नज़र आती है तो सेफ्टी कल्चर इसीलिए प्रमोट किया जा रहा है कि उस गलती को आइडेंटिफाई करे कोई टीम मेंबर और रिपोर्ट कर पाए. और जब वो कल्चर हम प्रमोट कर पाए और किसी को ब्लेम नहीं करेंगे उसके लिए, देन ओवरऑल सिस्टम इम्प्रूवमेंट आएगी वक्त के साथ. फॉर एग्जाम्पल, अगर व्हेन अ पेशेंट इज एडमिटेड टू अ हॉस्पिटल, देयर आर ऑफन मेनी डिफरेंट हेल्थ केयर प्रोफेशनल्स इन्वॉल्वड इन देयर केयर. So when you establish clear lines of communication and ensure that everyone understands their role in the patient care, medical errors can be prevented, at least minimized. Effective communications also identify the patient at risk to patient safety and address them before they become serious issues. Patient safety के लिए risk assessment and management भी बहुत important है. Because healthcare organizations must identify the potential risks to the patient safety and implement measures or processes to manage those risks effectively. पर्पस ही सारा ये है कि आप अपने डाटा कलेक्ट करें, उस डाटा को एनालाइज करें, उस एनालिसिस से आपको जो मिस्टेक्स नज़र आएँ उनको रेक्टिफाई करें. एंड दैट इज़ व्हाट इज़ दिस असेसमेंट एंड मैनेजमेंट. And then you continuously work to improve the system. That's the crucial step for incorporating patient safety culture into the healthcare system. It involves evaluating the current processes and identifying the areas for improvement to enhance patient safety. One example is continuous improvement is the use of root cause analysis to identify underlying causes of medical error and implement strategies to prevent them from occurring in the future. Another example is implementing regular staff training programs to ensure that healthcare providers are up to date with latest best practices and protocols. So, conclusion for first core component, it's the patient safety culture is a crucial component of health organization to ensure that the best possible healthcare is provided. It prioritizes the patient safety and implement the processes for continuous improvement and decrease in medical errors so that proper healthcare delivery which is safe for the patient is provided. और इसके components में leadership role, staff engagement, good effective communication and teamwork, risk assessment and management, and continuous improvement. These all are the components to ensure that patient safety culture are incorporated into healthcare delivery system. After you have incorporated the safety culture or at least started working on it, the next important step will be the second core component, that is building capacity for patient safety. ये involve करेगा that healthcare professionals जो हैं उनके पास sufficient knowledge हो, skills हों और resources हों कि वो patient को safe treatment provide कर सकें. And for that, training and education are the key. Training and educations can be of different forms, including classroom instructions, simulation training, webinars, on-job coaching. So by providing healthcare professionals with the tools they need to identify and mitigate risk to patient safety, organization can improve the overall quality of patient care. The first component was that incorporate the culture of patient safety, and then the organization works on building capacity for patient safety by empowering their service providers. So we'll go through why it is important to build the capacity, what are the strategies, benefit of building the capacity, different challenges and solutions, and case studies with examples. Building capacity for patient safety core component is the second core component. The component focuses on developing the knowledge again, skills, and attitude to ensure that safe and effective healthcare practices are done in the healthcare setup. And again, training and education's activities are the way to empower the service providers. Why it is important? Building the patient safety is crucial because it has a direct impact on healthcare outcomes. According to WHO, unsafe care results in millions of patient deaths and injuries every year. So by building a capacity for patient safety, healthcare organization can reduce the risk of harm to the patient and improve the quality of care they receive. Each and every health employee अगर educated है regarding patient safety, तो overall organization के अंदर आपका chances of medical error significantly reduce हो जाते हैं. One example of impact of patient safety is on the healthcare outcomes is the reduction of hospital-acquired infections. In United States, it is estimated that 1.7 million people will suffer from hospital-acquired infections, and out of those, approximately 1 lakh will die because of hospital-acquired infection. So when you implement strategies to improve patient safety, such as good hand hygiene, infection prevention control measures, and hospital can significantly reduce the incidence of disinfection and save lives. So building capacity is important as the patient safety will overall have a greater impact on patient outcomes. Strategies क्या हैं आपकी for building capacities, and we see it daily in our institution as well. We take these lectures and classes for granted sometimes, but training programs are the effective way of building capacity for any target, and that will include patient safety as well. Targeted design programs to educate healthcare professionals on the latest safety procedures and practices and protocols. They can also help the staff members identify potential risks and hazards that compromise the patient's safety. Training programs person to person, in person भी conduct हो सकते हैं और online भी हो सकते हैं, and they can be customized according to the needs of the specific institution. Second strategy to improve capacity building is education initiative, and that can be done to targeting the patients, their families, and healthcare professionals. They include educational material such as brochure, videos, and workshops. Education initiatives can raise the level of awareness about patient safety in the patient as well as health community, and they take an active role in their care in the care of the patient. Benefits simple है. अगर आप एक बंदा ख्याल कर रहा है या 10 बंदे एक ही चीज़ का ख्याल कर रहे हैं सारे मिलके, आउटकम्स किस में बेहतर होंगे? कैपेसिटी बिल्डिंग का मतलब ये है कि आप अपने सारे स्टाफ को एक चीज़ पे ट्रेन कर दें ताकि वो कॉमन गोल की तरफ काम कर रहे हों, एंड वो कॉमन गोल है कि देयर शुड बी मिनिमल मेडिकल एरर्स टू इम्प्रूव पेशेंट आउटकम्स, कि हेल्थ रिलेटेड हैजर्ड्स या हेल्थ रिलेटेड एलर्ट्स को या मेडिकल रिलेटेड एलर्ट्स को, प्रोफेशनल रिलेटेड एलर्ट्स को कम कर दिया जाए. What will have overall impact on the health system? The overall impact on the health system will be that there will be reduced cost, and there will be improved patients' trust and satisfaction level when you have a higher number of people performing the same task. Challenges mostly दो बहुत बड़े होते हैं. एक resources, that is a common thing that we come across, limited resources. And second is resistance. That resistance to change that we have seen in the system, that लोग जो आम फ्लो में जा रहे होते हैं, they do not want to change, they want to continue with the old system. So many healthcare organizations actually struggles with the limited budget and resources, which make it difficult for them to invest in patient safety initiatives and other strategies that will improve the patient safety. The solution to this is that we can involve other organizations or partner with other organizations in regard to patient safety, या फिर हम funds generation करवा सकते हैं and campaigns कर सकते हैं to raise money for patient safety initiatives. Resistance to change. Resistance to change के लिए they always need communication, collaboration, and persistence. मतलब this has to be a process that has to be repeated a lot of times, because के आदतें बदलने में अक्सर टाइम लगता है. तो effective communication, कि उनको इस बात का बताना कि उनकी प्रैक्टिस चेंज करने से उनको क्या, पेशेंट को क्या फ़ायदा होगा, उनके साथ कोलैबोरेट करना और इस चीज़ को बार बार दोहराते रहना, परसिवियर करना कि जब तक वो इनकॉर्पोरेट ना हो जाए कल्चर में, ये इम्पॉर्टेंट है रेजिस्टेंस को ओवरकम करने के लिए. केस स्टडीज़ में एन एग्जांपल फ्रॉम यूनाइटेड स्टेट्स के हॉस्पिटल इम्प्लीमेंटेड comprehensive training program for all staffs from nurses to administrators on the best practices on patient safety. This included regular simulations of emergency situations and drills to ensure all staff members were prepared to handle any situation that might arise. In addition, hospital established a culture of patient safety, which was the first core component, and that culture included transparency and accountability. It encouraged the patient staff to report any errors or near misses. What happened is that because of this initiative, the hospital saw significant reduction in the adverse events and improved patient outcomes. ये बड़े अस्पताल की बात थी. Then a similar example is from a small rural clinic where they recognized that there were many patients at risk of infection because of poor sanitation. So what they did, they introduced in the clinic hand washing for both patients as well as healthcare workers, and they did the education for that first. They also implemented the quality improvement project to ensure that all the equipment and the facilities were properly cleaned and maintained. As a result of these measures and capacity building, what happened, there was a dramatic decrease in the number of patients with infection and increased patient satisfaction. So up to now we have discussed two things. One was promoting the culture of patient safety, and the second was building capacity for patient safety. So now we come down to the third component, that is the implementation of patient safety incident reporting and learning systems. Now there is a sequence to the core components, and the first one was incorporating the culture and the second one was building the capacity. Unless those two are done properly, then you cannot implement the system of incident reporting and learning system. So crucial इसमें यही है कि आपका पहले कल्चर और आपके पास मैन पावर हो, कैपेसिटी हो कि आप वो रिपोर्टिंग सिस्टम को रन कर पाएँ. सो इसलिए ये थर्ड नंबर पे आ रहा है एज द कोर कंपोनेंट फॉर ऑफ WHO सेफ्टी एक्शन प्लान. ये क्या इन्वॉल्व करता है? दिस इन्वॉल्व्स क्रिएटिंग अ सिस्टम फॉर रिपोर्टिंग and analyzing the patient safety incidents, near misses and hazards. And what we aim from it, so by learning from these incidents, healthcare organizations can identify, improve and implement strategy that will reduce the chance of harm to the patient. Reporting system should be easy to use and accessible to all healthcare staff. They should also protect the confidentiality of the patient and the staff who reports incident. By creating culture of reporting and learning from the incidents, healthcare organization can improve patient safety and reduce the harm to the patient. So what we'll be learning? We'll be learning what are patient safety incident report and learning systems, why these are important, implementation of these systems and the challenges in implementation of the incident reporting and learning systems. Patient safety is a critical issue. By now we have discussed it fully. And when we seek medical care, we trust that our healthcare providers will do everything that can keep us safe. Unfortunately, mistakes will happen and the patient will be harmed. This is where the patient safety incident reporting and learning systems come in. जब काम हो रहा होगा तो गलती भी होगी, पर उस गलती को छुपाना या उस गलती को रिपोर्ट करना, यही जो है वो सिस्टम का, जब आपका पेशेंट सेफ्टी कल्चर और कैपेसिटी बिल्डिंग हो चुकी हो, यही वहाँ वो ये फ़र्क लेके आएगा कि आप गलती तो होनी है, पर गलती से जब आप सीखेंगे तो गलती के चांसेस कम हो जाएंगे. These systems are designed to help healthcare organizations identify and analyze patient safety incidents so that they can take steps to prevent them from happening in the future again. By implementing these systems, the healthcare providers can learn from their mistakes and improve the quality of care provided. So what is the core component? The third core component focuses on implementation of the patient safety, incident reporting and learning systems. These systems are, as I've already said, essential for identifying, analyzing, learning from the patient incidents in order to prevent the same incidences in the future. This can be challenging sometimes, but it is crucial that the healthcare providers have the tool and they have the necessary knowledge to report in order to improve the patient care in the best possible way. What are patient safety reporting and learning systems? Well, these are the tools in the health organizations which will be used to identify, track, analyze incidents that occur within their facilities. The process of incident reporting typically involves frontline staff members who are encouraged to report any incident they witness. The information is collected, it's analyzed by a multidisciplinary team which identifies the root cause in the system that caused the harm and will introduce the necessary measures from preventing it happening again. The goal of these systems is to create a culture of safety within the healthcare organization and promote continuous improvement in the patient care. Why implementation is important? Implementation is important because once the reporting is done, it will eventually lead to the improvement in the patient care, because when you identify your mistakes, you can do some things to correct them. And this automatically introduces the culture of continuous improvement. In addition, patient safety incident reporting and learning systems will promote transparency and accountability within the healthcare organization. Once you have a data, the patient and their families will have access to it, that what happened. And by implementing these systems, organization can demonstrate the commitment to open communication and patient-centered care. Implementing patient safety incident reporting and learning systems, important is to first establish the culture of safety within the organization. Without safety cultures, you can never promote the reporting. So once the staff is tuned to the culture, they have the attitudes and the values regarding the patient safety, then they will be inclined to do the reporting. So once the culture has been established, it is important then to develop a system for incident reporting and then investigations. This system should be easy to use, as already explained, and accessible to all the staff. And it should include the processing of analyzing the incident and identify the area of improvement. And it is also important that after analyzing identification, and finally, it is important to communicate the result of the incident, of the investigation to the staff and the stakeholders to ensure that the lessons learned are shared and the improvements are made. Challenges. One of the major challenges जो आपकी reporting में आती है, that is ensuring that all the staff members are aware of the system and know how to use it. This requires training and education, as well as clear communication of channels between different departments and level of management. Another challenge is ensuring that the data is collected through the system that is accurate and complete. This is difficult if the staff are hesitant to report the incident, or if there is lack of standardization in how the incident will be reported and categorized. So अगर आपका स्टाफ डर रहा है रिपोर्ट करते हुए, या उनके पास स्टैंडर्ड प्रोसीजर नहीं है जिसके थ्रू वो रिपोर्टिंग कर पाए, तो आपका डाटा यूजली फिर inadequate होगा. Additionally, there may be concerns around confidentiality and the fear of reprisal, which can further discourage reporting. So these challenges have to be overcome to increase the reporting in a healthcare system. Conclusion for core component 3, that patient safety incident reporting and learning systems are crucial in improving the healthcare outcomes and preventing the adverse effects. With the help of this system, health organizations can usually identify and improve the mistakes and ultimately provide a better patient care.